Welcome to our webinar, How Employers Address the Stresses Faced by Employees in the Post-COVID World. My name is Ryan. I am a business solutions and experience leader for Health Action Council located in the Chicago area. I want to thank our annual supporters who help make our member webinars possible. If you'd like to learn more about our annual supporters, please visit healthactioncouncil.org/supporters. Before I introduce our speakers for today, I'm excited to announce that the registration for our 2022 Invaluable Conference and Expo is open. Of course, last year, most of you know, we were entirely virtual. This year, it will be a hybrid event allowing people to join virtually and then in person as well in Cleveland, Ohio. Best of all, there is no charge for members to attend. And for those of you located outside the state of Ohio, we have a travel grant that'll cover most of your expenses. You can find that application under the registration tab on the website. Before we begin though, I want to remind everyone, if you have any questions, please use the chat function located in the Zoom navigation bar. We will be monitoring the chat box and will pause at the end of today's presentation to respond to your questions. If for some reason the chat box is not working, or if you run into any technical issues, please feel free to email us at events@healthactioncouncil.org. The webinar is being recorded and will be available to Health Action Council members on our website under the Member Center section at healthactioncouncil.org. If you have misplaced or forgotten your login information, please feel free to reach out to our staff and we will be happy to help you. This webinar is pending for both SHRM and HRCI credits as well. We will hold a poll at the end for those Health Action Council members who would like to receive those credits. Now I would like to introduce to you our presenters from 2nd.MD, Chief Clinical Officer Marsha Hyslop, the Cognitive Behavioral Health Therapist, Dr. Michael Klaybor, and Dr. Staci Passe. Welcome, everyone.
Thank you.
Ryan.
Thank you. Thank you, Ryan, for the opportunity to present to Health Action Council today. I'm pleased to be joined today by Dr. Michael Klaybor, who's a certified psychologist with over 40 years of experience, who is also on 2nd.MD's Medical Advisory Board and on our expert specialist panel. He specializes in anxiety and stress management, chronic pain and chronic illness management, depression, and chemical dependency. Dr. Klaybor is also a certified employee assistance counselor and works in executive coaching for workplace performance and leadership. I've had the privilege to work with Dr. Klaybor in so many capacities over the years and have truly appreciated his contribution to 2nd.MD and our members and our behavioral health programs and initiatives. Dr. Passe is a licensed social worker and licensed psychologist with over 20 years of experience. She has extensive experience working with young people with various behavioral health problems and the onset of mental illness, particularly those experiencing trauma, relationship challenges, concerns with body image, a history of sexual abuse and self-harm, and provides success coaching for parents who are experiencing those health challenges with their children. So let's get started. We've seen a continued rise of mental health concerns during COVID-19, and 2nd.MD and our subject matter experts have become a trusted healthcare resource for our clients and their employees, providing ongoing support and solutions during this pandemic. Today, we will review how employers can support their employees in these times of uncertainty and provide them tools to support mental health challenges, as well as ways to destigmatize those that struggle with these conditions. We are currently seeing the rise of mental health and emotional health challenges in the US. 88% of workers report extreme stress compared to 16% before the onset of COVID. 69% of workers claim this has been the most stressful time of their entire professional career. 72% of pregnant women and their new moms and they, as new moms feel moderate to high anxiety. That's up 29% before the pandemic. And according to the latest research, depression and anxiety in children have doubled compared to the pandemic levels. Employers are facing challenges in addressing these needs. Research indicates that 60% of workers say their employers could be doing much more to support their mental health during COVID. And 22% of workers said their company's focus on employees' emotional and mental health during the COVID-19 pandemic is barely adequate, a disaster, or non-existent. So what can employees do to support their employees and their families? Employees obviously have a lot on their plate, and there's a good chance a lot of their stressors could be interfering with their quality of work. Having the tools, the support, and guidance at their disposal to better manage stress can provide employees with better work-life balance. The support an employer can provide during this time is crucial to minimizing stress in and out of the workplace, enhancing productivity, and providing a safety net for the employees struggling with emotional challenges. So now let's get to our experts. Dr. Klaybor, what are employers saying that the kinds of mental health challenges are that their employees are facing?
What I notice, Marsha, is that with so many that I see are in extreme distress because they don't know what to expect anymore. There is a rise in all of the insecurities, the worries about returning to work, the confusing messages coming over, the networks. And so what's happening, I think people are rusty and they've lost their way. And so what they're really looking at is like some direction. They are confused, they're insecure. And so they're going to be relying on their managers and HR to give them guidance, structure, and some way to feel secure again coming back into the workplace. With hybrid models, some people have become really extremely distressed. So that's part one. Part two is, I think people are really reevaluating their work-life balance, what is important to them, and all the changes that have gone in through their lives in the last year and a half. So just to summarize, in this presentation today, what I want you to think of yourself is as a hummingbird, and you're going to go for the nectar of the things Dr. Passe and I have to say. Extract that which you can use, which applies to you. And as we go through this presentation, I want to help you figure out how to gear yourself up for what you're about to face as a manager, employer, human resource manager, because you will be inundated with things that are very challenging that need to be addressed and are very global. So let me stop there and we can go from there.
Thank you, Dr. Klaybor. So Dr. Passe, how is the pandemic affecting children's mental health?
Well, children absorb everything that Dr. Klaybor just mentioned in terms of adults. And so not only are they trying to minimize the risk of their parents' stress, but they're also having to cope with their own dysregulation during this time. And so a few things that I'm seeing really come up with kids is a very strong response to the inconsistency that's happening right now in their environments. And so as we navigate COVID, there's an ebb and flow, and we're learning more, and we're changing policies and protocols. And now the kids are back in school, so they have a whole other set of parameters that they have to comply with. I kind of think of it in terms of a Goldilocks syndrome. And with the ebb and flow of the pandemic and the symptomatology that we're seeing with COVID, kids are trying to figure out, well, how much is too much and how little is too little and what's just the right amount. And so that is in regards to mask wearing, in terms of social experiences, in terms of interacting with maybe higher risk populations like grandma or grandpa. So they're getting all these messages from various places that are saying, okay, well, this makes sense, but oftentimes that's in contrast to other information they're getting. And so that cognitive dissonance the disparity between the information that they have and the behaviors that they're seeing is really perplexing to them, because they have all of this knowledge that they're hearing from parents, schools, media, and they're going out into the real world, and people are not consistent with the messaging that these kids are getting in these other places. And so they're sitting with a lot of distress, a lot of powerlessness, and a lack of control.
Thank you, Dr. Passe. So Dr. Klaybor, how can employers help employees manage the heightened anxiety we're seeing during the pandemic?
I think the best way they can handle what's coming toward them in terms of employee anxiety, fears, worry, is first do a check inside within about your own energy and your own messaging and what you're exposing yourself to. So for example, if you're anxious about what's going on with your children, your work status, that will get transmitted, that energy. So being mindful and present, being able to really relate and communicate directly to your employees about what their concerns are is crucial. So having additional opportunities for people to feel heard, validated, be able to have discussions about what's going on and what's changing in the workplace is going to be crucial. So that what you're going to be finding is that the insecurities, again, the depression, the anxiety, these transitions, all are going to be surfacing. And people need some sense of security and reassurance. And so that's what you have to be inwardly. If you're talking to someone as a manager, you have to be in such a place that you feel solid, but you're also vulnerable and open about your own insecurities and saying, you know what, we're going to get through this together. And how do you really validate them and just really listen and show that you really hear them? Then they'll feel really connected.
Great. Thank you, Dr. Klaybor. So Dr. Passe, how can employers support parents?
So I think the most important, consideration for employers when they're supporting the parents and their employees is being mindful that this is just a trickle-down effect. And so the way in which the managers show up for the employees, that is a similar fashion in which the employees/parents show up for the children. And so we need to be really cognizant that through all levels of the organization, there should be a streamlined support. And so to Dr. Klaybor's point of, these touch points being very solid and secure and kind of how they're showing up for their employees, then that will give the security and the safety for the parents to then take that home and transfer that energy to their children. And so, going back to all the inconsistency right now with routines and schedules and school back in session, employers really need to be flexible. They need to practice, support and latitude. There's going to have to be a lot of moving parts as we're, navigating this pandemic. And so just thinking about all the responsibilities that parents have before they even enter the office for the day. And so they're coming to work with, a headspace full of kids and, soccer and school and quarantine and exposure. And so it's not always maybe showing up as the, best work self, because they're having to have all these different roles that they're now having to reconcile as they enter the office for the day.
That's super helpful. So we've seen companies implement unique ways to help emphasize the importance around mental health and well-being. So for example, Scientific Games holds Take Care Tuesdays for their employees to focus on their mental health and conducts webinars, which are webinars focused on mental, emotional, and physical well-being. And Ernst & Young recently boosted its mental health offerings to include 25 no-cost counseling or mental health sessions per employee per year. So EY also extended the benefits to all family members in the household, including domestic partnerships. SAP, which is a software solutions company, and Intel have also implemented a paid mental health day for employees. A tip sheet is available to everyone who's attending this call today that focuses on the steps employers can take to make mental health and well-being a priority in the workplace. And you can visit secondmd.org/HAC to download this helpful tool. So let's move on to another question, Dr. Klaybor. As companies are returning to work, what should employers be mindful of from a mental health perspective?
Well, as noted in the early statistics that you quoted, anxiety is up 30 to 40% in people. The prescriptions that have been given for depression are up about 40% in this country. That stress is at a high level because of the ever-changing news every day. I limit myself to 3 minutes of news a day because of this notion of vicarious trauma. So noticing what people are paying attention to and realize that they're coming in vulnerable is the first. Now, in the workplace particularly, there's this really pretty excellent tool called the Workplace Outcomes Suite. If some of you haven't heard about it, it's through Employee Assistance Association. You can get it for free. Let me tell you, it measures 5 different things, which are all relevant to this entire webinar. 1, absenteeism, looking at who's showing up or not and why and what are the excuses. 2, presenteeism, even if they're there, are they really present when you see them? Do they do staring off into space? 3, is there a loss of productivity? 4, what are what is the distress in the workplace that people are experiencing? And then in general, what's their life satisfaction? Many people that have been in this whole return, problematic kind of, are we on, are we off, masks, no masks, vaccine, no vaccine. The communication channels that you provide as an employer are essential. A consistent message, something stabilizing, something that you have talking points that everyone can have some sense of reassurance. So from a health standpoint, realize that people are anxious, depressed, they're scared, they're stressed, and they are insecure. And so many really need you to be stable to reassure them so that they can be okay. And what Dr. Passe said is so crucial. I want to tell this one little anecdote. I run on this boulevard. We have this path in front of my house. Well, almost in front of my house. And I was running the other day, and there I watched this woman that's pushing this cart with her 2 or 3 year old child. And she's running on this beautiful path, looking at her phone, reading. I look down at the child. The child is staring at his hand as though just mimicking the mother. I went, whoa. So with that in mind, realize people are going to follow you and mimic you by your mood, energy, what you pay attention to, what you say. So be mindful of your own work-life balance, your ability to rest, to sleep, and check in with yourself so that you're clear as to help you with others.
Yeah, that's super helpful, Dr. Klaybor. So, Dr. Passe, what are some of the main concerns that parents have as their children return to in-person learning?
So that was a great segue, Dr. Klaybor, because the way that kids see their parents responding to all of these stressors, they absorb that, and that becomes their style of coping. And so the concerns that I hear parents, verbalizing right now as we go back to and as things kind of pick up, but also, there's many roadblocks still in our way. The concerns are twofold. One is there are significant worries about their children's academic success. And so with all of the, breaks from school and mandated, quarantines for exposures, I mean, that's happening probably more regularly than any of us are aware of. There's these gaps of time that children are missing out in academic instruction. And the parents that I work with are kind of freaking out about it, thinking that their child is never going to recover. It is absolutely imperative that we remember how resilient children are. So the set of concerns about academics, there's catch up. We can, that stuff, the timeline is long. Kids' brains grow until they're 24 years old. So we have plenty of time to catch up academically. The other set of concerns that I hear parents talking about a lot are the social experiences that their kids are missing out on. And so, in terms of psychological and emotional well-being, of course, that's where my emphasis is at, and really working with parents to figure out creative ways to generate social experiences for their kids, especially parents who have children that are young, 5 or 6 years old. The pandemic has been a large part of these children's lives to the extent they might not remember pre-COVID times, right? And so on one hand, that's reassuring that this isn't as jarring for a lot of kids as it is to us, because this time frame is much shorter in the duration of their lifespan. But on the other hand, if this is kind of their norm, how do we mitigate some of the outcomes that could potentially be really damaging? And so thinking about social experiences, I just really, really want to encourage employers to keep in mind this idea of supporting parents and kind of thinking outside the box and taking care of their kids. And so that might mean, workplaces becoming a little more flexible with work schedules so that parents can arrange for, their child to have some kind of outlet at 4 o'clock that is COVID safe, that might be necessary for that child's development, and also interrupt the workday, but just really finding a way to work around some of those obstacles, because the end goal is that we, foster this generation of children that are thriving, that have overcome this pandemic, and that are in a good position to be even more resilient to some of the future hardships that they might come across. So it's kind of an opportune time, but we all have to lean in and support these kids in doing so.
Really good guidance, Dr. Passe. Thank you. So, Dr. Klaybor, with stress and burnout on the rise, what are some of the things employers can do to mitigate these risks among employees?
Outstanding question. I want to start off with saying this. Dr. Passe and I are colleagues. My office is right next door to hers, and I just love listening to her. She's brilliant. She is so great at what she does. And secondly, my time was second MD, and this is relevant to your question, just a little background and context. I think the work culture at second MD is one of the most positive, affirming of any corporation I've come across. And I don't get an email from one of the nurses or staff or Libby or Simone or many of the other people I work with at second MD that isn't, thank you for your help, we appreciate you. So with that in mind, think for yourself about what your work culture experience is. Do you make the work culture in your space a positive, thoughtful, validating, valuing one? And do you do that even for yourself? What is your self-talk like? So what do employers need to do? They need to validate their employees. They need to express appreciation. They need to find purpose and value in what they're contributing and make them feel secure and appreciated. And I will tell you a quick story of something that I'm so excited by this that gives me chills. There was a patient I had yesterday that was 1 block away from 9/11 towers. He lived 1 block away. His life changed 180 degrees. He was powerful. He was in a big law firm in New York City and doing very well, growing, expanding. And his life crashed and burned. And he's on disability. And when he came to me a little while back, I said, okay, it's time for us to help you resolve your trauma, help you re-image and reprogram yourself about having a life, and put this behind you. And we have to visualize and create a way for him to feel safe again and not guilty and not shame. And the other part of what's happening in the workplace is for employers is that, believe it or not, productivity has gone up. People have lost more work-life balance by staying home. They feel guilty, they keep working more. I actually worked with a lawyer. I worked with this woman that was a first-year lawyer, and in 1 week, 1 7-day period, she billed 76 hours. She was working 16 hours a day, 7 days. So she's totally lost herself. Was she anxious, depressed, and angry? Yep. So can you support their work-life balance and clearing away some of the obstacles and just letting them feel appreciated? That's where you have to start as an employer. Give the culture a safe, positive messaging and place to be.
Thanks, Dr. Klaybor. So, Dr. Passe, are we actually seeing children expressing burnout?
So I think that's a loaded question, because you have to look at the families and the parents and the leaders of the household, right? So the kids that are having, this opportunity in their home to reframe this experience in a positive way, and the parents are encouraging growth, fostering resilience, those kids are absolutely more protected against burnout. However, in homes, which are the majority of homes, right? Kind of to Dr. Claybor's point about this exponential growth in depression, anxiety, medication, in those families, the children are byproducts of their parents' experiences. And so in those families, those are the families that I see in my office, right? Absolutely, the kids are experiencing burnout. And so once again, we have to think about it developmentally, because for very young children, the last 18, 20 months has been a huge portion of their life. And so if they're living in that distress, if they're living in that anxiety and that depression that their parents are projecting, then that is at times very overwhelming for them. And so in homes where the parents are getting the support that they need from their employers, from their workspace, from their community, then they are better equipping their children to come out on the other side of this. And I came across this really cool reframe of how kids might be, actually ahead because of the pandemic. And so I'm just going to share a few of the statements that I thought really resonated. And so it starts off by saying, what if instead of falling behind, this group of lockdown kids are actually ahead? And so it talks about, what if they have more empathy? They enjoy family connection. They can be more creative and entertain themselves. They love to read. They love to express themselves in writing. What if they learn to understand the value of money, what's important, and how to live with less, right? Because the workspace has decreased some financial stability with some families. What if they learn the value of eating together as a family? Mom and dad are home more often. What if they learn to just be, to be resilient, to be content? What if they learn that they are the ones where their value is the greatest, that they don't put it on teachers or educational professionals or the people in their community, that they learn to just be satisfied with how they show up in the world? What if they're the ones to learn to cook, to organize their space, to do their laundry, to do simple things like gardening? What if they can just sit and be quiet? And so when we think about all these opportunities and all the stillness that this pandemic has brought in the world, there is a privilege of being able to sit in that space. And the caveat to that is having the support that we need from all of these macro systems in our lives, the community, the workspace, so that they can encourage parents to facilitate this kind of home life with their children. And so if we're able to kind of abide by these parameters and this mantra, then we will see this generation come out ahead, not fall behind. But the onus is on us as the adults, as the caretakers, the employees, the policymakers, to create a way for that to happen.
That's so true. So Dr. Klaybor, for employees who continue to work from home, work-life balance has become blurred. So what can employers do to help employees manage this better and reset this work-life balance?
Well, I think they can do a lot to help reset that work-life balance. But let me mention just quickly that there are download tip sheets on several of these different items we've been discussing today that you can actually, everyone can go down and steps for employers to take for mental health and well-being priority. So go to secondmd/HAC to download so that you have access to some very specific information and things to follow. But to answer your question, work-life balance becomes blurred. I think a little context is helpful. One is, most of us are very accustomed to plugging into a system, like a structure, time to be there, things to do, and in the way of disciplining ourselves. We've lost that to a large extent by being at home. People don't have those same conditions, parameters, triggers, systems in place to plug into. Not long ago, I'm working with he's a CEO. He has about 300 employees. And what he did was so brilliant. It was like, oh my goodness, I should do a blog about this. What he did is he set up his workday, even as a CEO, to have his, meet with his children, have breakfast in the morning, work till 10:30, and then he would have a recess with his kids and play with them for 30 minutes. And then he would do his work, trade off with his wife. They created this structure. Then he would have his lunch, but he structured his day in life around keeping some semblance of really feeling in control and making the kids feel more secure as children, is what Dr. Passe was saying. They model it. So he was meditating in the morning. It reminds me, there's a pretty interesting book by Tim Ferriss. Tim Ferriss has this large podcast following, and he wrote this one book called Tools of Titans. And essentially the Tools of Titans book looks to me like edited versions of his podcast of about 150 different elite athletes, CEOs, entrepreneurs, billionaires. I mean, yoga teachers, authors. He's got quite a cross section. And what I noticed in the book is the themes. One, that each person he would interview talks about how they start their day. They meditate or what time they wake up, and they have a very structured, disciplined system. But he also noted, after interviewing all these people, that the most successful people do one thing that is consistent that many other people don't do. And he termed this, they start their day by swallowing the toad. And what that means is they take their hardest task on first, rather than wait. You don't scroll and look at email and do this and then work your way. No, they take on their most difficult, challenging projects first, rather than avoid. So finding ways to help people restructure their lives, set better systems up, whether at work, hybrid or not, talking about what it's like coming back. I'm seeing this other lawyer that his main message to me was, I don't want to go back to work. I like working from home. Now, one, he's an introvert. Introverts love being alone. Pandemic has actually been a blessing for many introverts. Extroverts are going crazy. They're saying to me like, oh my God, I used to hate going to the break room. Now I miss the break room where everybody would just talk and chat. I have no one to relate to. So who your employee is, are they introvert, extrovert, matters. And so their needs matter. And so, checking in with them. Are you sleeping? What's your energy like? I have something, a blog I did one, I call it FQ. What's your fun quotient? What are you doing for fun? What's your social quotient? What are you doing to interact? There was an employee that is an expat employee that I work with that moved to another country and had to leave everything behind. And one of our projects was, once he got there, was to write handwritten notes to like 10 of his best friends to let them know how he felt about them and his feelings. We had him contacting his parents in Thailand more frequently, his sister in Colorado, so that he didn't feel so disconnected, finding ways to connect inwardly to what he's missing and what's important to him. So think about that for yourselves. What are you missing? What toad do you need to swallow? What are you avoiding? What do you need to do for sleep hygiene and rituals to get you more rested and comfortable and really feeling more balanced inwardly? Because again, like Dr. Passe was saying, kids will model you. If you're anxious, they'll be anxious and they won't even know why. But so you need to bring a a positive energy to everything you do, and really do a lot of self-examination. I do have to share this last story. So my 13-month-old grandson was here the other day, Sunday, and he's just about where he could walk, and he pulled himself up. We have this mirror, 5-foot mirror in our bedroom, and now he's crawling all over the place. And he grabs the mirror on both sides. He looks at it, and he starts kissing the mirror like 5 times. I have a video of it. I couldn't stand it. It was like, he just kissed. Then he'd look behind the mirror, kiss it again. We need to be that involved and like ourselves as much as he did what he saw.
Oh, that's a great story, Dr. Klaybor, and great advice. Oh, that's great. So, Dr. Passe, if a parent is struggling with stress and anxiety, how can they minimize the impact of their stress and what it's having on their children?
I love the idea of a fun quotient. So I just want to start with that, because the world is so heavy right now that kids are just kind of like, begrudgingly going through their day and feeling all this weight everywhere around them. If parents can insert a fun quotient to daily activity, that would be an amazing thing. And that can look lots of different ways, right? Music while you're doing chores, art, all kinds of going outside and throwing the ball. So yeah, I really like that idea. Some other things that come to mind are this idea, that parents have of protecting their children from hard feelings. We have got to eliminate this notion that sadness and grief and worry and stress is bad. It is not bad. It is a feeling, and it is our job as parents and employers and community providers to empower parents to learn ways to express their feelings in a way that models regulation, that models coping and management. And so when parents are feeling the stress and the anxiety and the depression, it is imperative for them to be transparent with their kids about hardships, right? While also managing boundaries. So the kids don't need to know that bills might not get paid, or that mommy had to start an antidepressant, or that daddy's job is being threatened. They don't need to know that, but absolutely they can know, mommy's really feeling overwhelmed, or daddy just needs a break and he's going to go for a jog to kind of get, back into a good headspace, because they are learning from us how to deal with this. And if we don't give them a little insight that this is difficult for us, then they're left, to their own devices, and they're left in their own feelings thinking, well, this must be weird or different because no one else is feeling sad in my house, right? So being very open about the difficulty of this time for everybody, and helping teach and practice and set an example for how to do hard things, right? Because we all have hard things that we have to do every single day. Setting boundaries in the home around, information that we're getting, media. I like Dr. Klaybor's limit of 3 minutes. And I would add that for children, especially, older kids and teenagers, they want to know what's going on. But instead of sitting in front of a screen and just absorbing all the information, have them read, because then they can select what resonates with them. And they have more power and ownership over what they are putting into their headspace, right? Creating routines in the home. A lot of times parents think, oh, well, this is a hard time for the kids, and so we're just going to have, a free for all, and, stay in our pajamas all day, and, eat, snacks for every meal. Absolutely not. Kids thrive on consistency. They need to know what to expect. The worst thing that you can do is revert back to complete chaos in the house. They need to know what is coming next. They need to have consistency, and that looks like getting up at a certain time, even if there's no school, even if they're on quarantine, even if getting up at a certain time, making their bed. So when Dr. Klaybor talks about swallowing the toad, for kids, get them up, make their bed. It psychologically puts them in a space of order and routine for the day, right? Having screen time limits, having mealtime windows so that they know between 12 and 1 we're eating, between 6 and 7 we're eating, having designated time to go outside and get fresh air. Kids need on average 20 to 30 minutes of outside fresh air a day. You've got to make sure that you support them in doing that, which means you might have to go outside and play basketball with them, or you might have to go on a walk with them, but they need that as part of their own self-care. Really thinking about how we can practice gratitude in this time is important, because for kids who experience the day-to-day, kind of hardship of what's going on in the world, they also need to know that we are in a position, everybody watching this is in a position to where we can practice gratitude for even the small things. And so if that becomes part of a daily routine in your home at the dinner table or before bed, or, whenever you can designate a time to just practice gratitude, and everybody can say a few things that they're thankful for, and they can be as insignificant or significant as makes sense. But for children to not get caught up in this idea of the doom and gloom, right? That there are opportunities for us to be thankful for things in our lives. Providing reassurance and security. So going back to this idea of we all have done hard things. This is another hard thing, and we'll get through this hard thing, right? The installation of hope, knowing that there's bookends to this. The pandemic started, the pandemic will end. We're just kind of in the thick of it right now, but we can look ahead and say things will get better. We'll come out on the other side. Back to kind of what I shared before, we might even be ahead, right? Kids might be a lot more emotionally intelligent than they were pre-COVID. So really taking advantage of a time to teach kids how to manage difficult experiences, because they're going to be better for it in the future. For sure, that's a certainty, right? That they're going to have future obstacles and hardships that we can prepare them for now.
That's great advice, Dr. Passe. Thank you. Dr. Klaybor, how can HR professionals coach their managers to help emphasize the importance of mental health and well-being and resources that are offered?
I think they can help coach them, one, by being empathetic and compassionate. They need to really be able to tune into what they're feeling and be attentive to them. Secondly, really being able to say, look, if this gets beyond you, we have perhaps this company doesn't, but has an employee assistance program. You can get 1 session for assessment and refer. They may have 3 sessions. They may have an 8-session short-term model. Just say, go talk to somebody. I noticed that in my practice that I hear this frequently. I'm the only person many of these people talk to. And I mean, I'm talking CEOs who can't talk down and they don't want to talk to anyone else, so that they have an objective place to debrief and vent. And so not trying to fix the problem, because you really can't, but being a good listener is healing for people. Just someone who listens objectively and is empathetic, and you do a lot of head nodding and and thank you for sharing, and there is I send this link out to a lot of my patients, which is by Brene Brown. It's empathy fuels connection, sympathy drives disconnection. So there is this 2.5-minute cartoon video that if you go to YouTube and put in Brene Brown empathy, it's something that will help tune you into how do you be empathetic, not sympathetic. People don't want someone to feel sorry for them. They want someone to connect with them, and how just to listen and make that a practice. So let them know they're valued. Let them know that there are things the company's doing. Maybe you're going to have speakers come in like this webinar, watch this webinar. I mean, 2 weeks ago, I got two new calls. I did a CLE, a continuing legal education program for the Texas State Bar. The people called in and say, hey, I saw this and what you said about being mindful and present and how to regain control of your life. And I want to come see you and talk to you. Something resonated. So I want to go back to what I said at the very beginning. You have to have self-care. You have to be mindful of your own energy and positivity or negativity and how you're feeling, what's going on, and deal with your own feelings. Once you get some alignment there, then you go forward, and then you're more helpful to others. But bring in seminars, bring in experts, bring in a counselor to be there full time one day. Turns out Google I was reading and talking to a friend a while back, found, that so many of their employees were having difficulty that they brought one counselor on board and put him just in an office. Within 1 year, they had 33 full-time counselors in another building employees were going to for help. So there are things the company can do. HR, look at your say, look, try your medical benefits. See if you have mental health benefits, and get a provider, get a referral list of places where people can go for support. Besides anxiety, depression, substance abuse has been on the rise. Overdoses have been on the rise. Calls to suicide hotlines. I read one study increased by 300 some percent, the calls to suicide hotlines. So mental health is a big problem. Deal with it. Don't ignore it. Don't put on blinders and think, oh, well, I don't know what to do. You can know what to do. Get people some help, get some resources. And by the way, I happen to know an excellent one called Second MD that provides wonderful resources and amazing number of very, very excellent providers. So use your resources, reach out, ask each other, see who they're using. But again, find your own empathy, be a good listener. I like what Dr. Passe said, gratitude. You focusing on positivity and what's good in your life. And stay away from the news. I think news can create vicarious trauma. People are traumatized, more confused. And so just get them away from that and try to get them into something like nature and taking walks and getting exercise and breaking free of how we're inundated with this real-time sort of trauma and drama going on in the world.
That's really great advice, Dr. Klaybor, and a good segue into more about how mental health just really sometimes just goes undiagnosed, and access to mental health providers and resources are also pretty challenging. And thank you for talking about how Second MD can help, Dr. Klaybor, because we have helped many of our members overcome barriers and challenges in this space through really our highly experienced behavioral health nurses, and they're trained to learn more about the member's condition and provide education, guidance, navigation, and steerage into quality in-network providers. And we also have a multidisciplinary team of top mental health experts, including psychologists, psychiatrists. Many are just like Dr. Passe, Dr. Klaybor, and they can connect our members really in a face-to-face consultation in the comfort of their home, and guide them and coach them and really help them through, some of the decisions they need to make about the next best step in their care. And these can be life-changing in terms of guiding our members really to where they need to go next and improving their overall outcome. So in these consultations, many times our experts address diagnosis, testing, tools and resources to help manage behavioral health issues such as anxiety and depression. They have medication questions, substance abuse guidance, and really lots of multidisciplinary opportunities to address many complex mental health issues and resources that can help our members. So moving on, Dr. Klaybor, what are some signs and symptoms of anxiety and depression, and what are some things that employers should be looking for?
Just when you're with someone, see if they even make eye contact with you. Are they really listening? Do they feel like they're attending? Do you feel like they're really present? What's their energy level like? Tune in and just say, what are you feeling? How's this been for you? Are there changes in self-care, personal care, appearance? Do they look disheveled? They seem indecisive. I mean, I know these kind of seem like clinical, but just use your gut instinct really about what you sense, and then maybe comment, how are you doing? How are you feeling? How are things going? And then just open up that channel, and then maybe it'll go somewhere or not. And you can say, well, we have resources or ideas. You have any ideas of what we could do? So you just open a dialogue, not a monologue of what you need to do or what you think is right, but a dialogue to engage them, to draw them out a little bit, to see what might be needed. And maybe they're, in a dark space in their relationship. That was the other thing I noted when I was doing some research on this for this webinar, is that domestic violence abuse has been up very significantly. And so people being confined in their home, workplace, and then if there were troubles in the marriage before, that's worse. Two, if there were mental health, anxiety, depression problems, those are exacerbated. So advocating treatment, getting help, getting second opinions, getting someone to talk to is really the starting place. So using the vehicle of whatever resources you have, your company provides. I'll tell you one example. This is kind of dramatic, but about 2 years ago, I was working with a lawyer in a big law firm, huge national law firm, who had come in because he was having troubles, couldn't get to work. He hated his job. He couldn't get up in the morning. And I said, well, how much are you drinking? Well, he binge drink on the weekend, and he was hungover for 2 to 3 days. Well, we fixed that problem. And it turns out that stress was so high in this company that one of his colleagues committed suicide. Well, the company didn't put their head in the sand. They brought in experts, they brought in counselors, they have monthly seminars now on well-being and how are people doing, and they address it. Now they have one every month, and so they really look after their employees. So think about that for yourself. What are we doing? How could we be proactive in helping us really support our employees during this very, very trying, difficult, scary time, which I think the world is.
Great. Thank you, Dr. Klaybor. So Dr. Passe, what are some signs and symptoms to actually look for in children?
So to answer that question, we kind of have to think about some of the variables to consider. So, when we look for symptomatology, we have to be mindful of how that looks developmentally. So the way that children exhibit distress is much different than the way that teenagers and young adults exhibit distress. So for children, you're going to see a lot of somatic complaints, stomach aches. Oh my goodness, I've seen so many kids with GI issues, lots of referrals back to their pediatrician and gastroenterologist, and tummy aches, pains in their body, headaches, sleep disturbance. So these are all what, we can see in children, lots of regression. So, 9 or 10-year-olds maybe start sucking their thumb again, changes in eating behavior, just kind of looking at where they're at developmentally. And if you see kind of a backslide, that's definitely cause for concern, right? For teenagers and young adults, this is not going to show up so much somatically or in a regression fashion, but you're going to see much more moodiness than what is typical for a teenager, which is hard to decipher sometimes. But you're going to see lots of isolation, irritability is a huge one, because for teenagers and young adults, their primary support system is their social support system. That's where you can see a lot of shift. So if they are spending less time with their friends, if they have less interest in connecting with other people, if they are in their room and not wanting, to come out, or if they're not engaging with, the community, or not wanting to go to church services, or whatever that looks like, that social nuance is important to consider. And then also looking at gender differences. So between, stereotypical male gender and female gender, they show distress in much different ways. And so for males, there's a lot of acting out, we call it. And that's what you can observe. Those are behaviors that manifest, such as fighting, yelling, screaming, destruction of property, the things that you can see happen in real time with your eyes. For girls, especially, tween, teen, young adult, there's a lot of acting in, and that's not always observable behavior. They might become, more depressed, restrict their eating, self-harm, crying. So it's not as, explicit as you might see with young boys. I have seen a significant increase in incidents of self-harm with teenage girls. It's become pretty much daily practice to talk about safety planning in terms of, cutting or suicidal ideation. Or so the way that these kids are demonstrating their distress is important to recognize in terms of gender differences and developmental age differences. And then also just considering the individuality of each kid. And so as employers and as support systems for parents, some of the questions that we can ask are, is your kid showing up different than they did last month? What is different about them? And so all of the things that I just mentioned, that's data, but if there is any kind of evolution or shift or transition, then that is information that we then follow up with, right? Perhaps it's just anecdotal, but perhaps it really is something. So equipping parents with the support that they need to ask the hard questions, to have the difficult conversations, to just kind of do these well checks if they see any kind of movement in how their kids are experiencing stress and distress right now.
That's super helpful, Dr. Passe. Thank you. So, Dr. Klaybor, what resources and support can employers provide their employees experiencing mental health concerns?
Well, the resources and support is getting them the information that they have mental health benefits, what they can do, how to access them, get them to their EAP, get some opportunities out there for them to like have some groups, some in-service training, some for managers about how to deal with the emotion. You may just have training for HR or for managers, which we actually do in the EAP field. It's like when there's a productivity problem, how do you manage it? What do you do? So you need to be resourceful and reach out to see what's out there and available. Bring some people in, have some training, some programs, some videos, messaging, get a campaign going, I think.
Great. I think we're at the top of the hour, so I'll turn this back over to the Health Action Council. But just want to say real quickly on behalf of 2nd.MD, Dr. Klaybor and Dr. Passe, we're very grateful for the opportunity to present to all of you. Turn it back over to Health Action Council now.
Yeah, so we actually got a few questions in, so I'll just ask these, and if you'd like to give some quick responses at the end of the hour. First one's for Dr. Passe. So for children who may have friends across the spectrum of no social distancing to full quarantine, how can parents address some of these inconsistencies and empower children to set their own boundaries?
So, when we talk about the nuances between families and school and church and all of the ways that people are managing this, it's really important for parents to be very clear about the non-judgmental approach that we take, right? And so just using verbiage like, it is our family's belief system, or the family value right now is, or this is the way that we're doing things, or everybody, is thinking about what's in the best interest for their family, so that it doesn't become adverse, so that it doesn't become this tense experience where, their best friend Jimmy is able, to go outside and play with all their friends, but I'm at home having to, quarantine. And so just being very transparent about, this is how our family does things. This is one way that families do things, and there's lots of other ways, but this is what we're choosing right now. And then being very creative about social experiences. So I've worked with families to, create like drop-off packages. They would go to their friends, drop off, a game, and then they would Zoom later and play the game together. Doing drive-bys, they don't actually get out of your car, but you're talking through the window in front of someone's house and, making sure that they're able to lay eyes on different friends. And so the virtual experience is definitely one avenue that we can maintain that social connection. But just going back to this idea that especially for preteens and teenagers, their social support system is their primary support system. And so we've really got to lean in and do all that we can to generate experiences for them to kind of keep connected with, their social environment.
Yeah, and I think that's great advice. So Dr. Klaybor, we have a question for you. how can employees balance addressing mental health issues or concerns with their employees without violating professional boundaries?
Well, that's a good question, because you don't want to try to step into their mental health problem. You want to put a safety net around them to say that you have resources and thanks for sharing, and just really let them know what's available to them. Like I said, maybe if you have an employee assistance program, or you have connection with your benefits people to know what your resource list is for, if it's a rehab problem or whatever it might be. But yeah, don't focus on the productivity, absenteeism, presenteeism, those kinds of issues as concerns, and then let them know that you empathize with them and that there are ways and means for them to get some help, so that you're encouraging, you're supportive, you're positive to help redirect them, and appreciate them for bringing it up and being brave enough to even say that, and say, look, I'll be here, do some exploration, let me know how it goes. I want to help follow up with you to show a real interest.
Great. So I just want to thank our speakers real quick for being with us today. I'm going to turn this back over to Ryan, and we have a few questions at the end of this webinar if everyone wants to stick around for a few moments longer.
Thank you again. So guys, we are now launching the CE credits poll. If you are interested in SHRM and HRCI credits, please complete the poll. Thank you for joining us. And a quick reminder as well to please join us for our next member-only webinar, What's New with Mental Health Parity. This will be held on September 28th. If you haven't registered already, please take a moment to go and do so. Thank you again for joining us, and we'll see you soon.